Hi, everyone. My name is Dr. Pola, as you know, formerly known as Dr. P. Today, we will be discussing breast health on a wider basis. However, in Africa today, I believe that we are in the month of breast cancer awareness. So, I have here with me.
Hi, I'm Mrs. Mary Aqua.
And I'm Mary.
So, with two ladies, I believe it is quite appropriate that we will do a very good justice to everything that we'll be talking about today. So, as we're talking about breast health, we need to understand that there are several occasions and several situations that can occur with breasts, and those are problems significantly. One of them is considered to be a DH, a typical ductal hyperplasia. This is when you have overgrowth cells in the milk duct. That particular condition can lead to cancer in the future. It's a risk. We're going to discuss some of those considerations later on. Then we have fibristic changes. They said that that is non-cancerous condition. However, it causes lumps and pain. We're going to talk about what they think and what sometimes in the true world occur. Then you got fibroadenomas, which again is considered to be non-cancerous. And it is when the breasts have solid lumps that are smooth, firm, and rubbery. Then we have breast cyst or cyst in the breast. That is when the breasts have fluid-filled sac, cause lumps, and also tenderness in the breast. Then we have also fat necrosis, which are lumps from injury. Fat cells are damaged and it can become lumpy. It too can cause pain in the breast as well. Then you have mastitis, which are inflammation of the breast tissue, redness, and pain. It can also lead to an infection in the breast. Then you have gynecomastia, which are enlarged breast tissue in the male. So most people may think that breast condition do not worry male. It's only have to be considered by female. Well, no. Gynecomastia is actually an enlarged breast tissue in males. Then you have intraductal papilloma. It's a small benign lumps. It causes the nipple to discharge something bloody. Sometimes this may not smell too good either. Then you got pocket disease, which is a rare kinds of cancer. It affects the nipple and also the areola, and it causes scaling, itching, and discharge that comes out of the breast. Then we have outright breast cancer. Now, these are the things we are about to discuss, and we will jump right into it. So, we will be discussing ADH and also FC, which is, we're looking at also not just cancer of the breast, but we'll be looking at cysts of the breast, fibroids of the breast, and some other problems that we could have occurred in the breast sometimes. Now, what is breast cancer? The first thing we need to understand is cancer, it's only a matter of the breast. Cancer can be of different part of the body. And at the same time, there are different kinds of cancer. So let's discuss not just cancer, but other issues that can occur in the breast as well. So if it is a matter of atypical axial hypoglycemia, which we call ductal hypoglycemia, it is considered to be a painful thing. It can cause lumps, in the breast, and it can also cause some form of irritation. Then if we're talking about cyst in the breast, then we're talking about small bubbles, or sometimes they can be big, but they're carrying liquid inside. So before we even get into quite a few other things, I would say that one few of the things we want to talk about is how does a woman check her breast? So the one thing. Another one is if they are checking, what are the different positions that a woman need to be into when she's checking the breast? Because obviously some women, due to the size and the shapes of the different breasts, they cannot check in the same manner. So we will talk about that as well. Now, what is cancer of the breast? The proper name they are giving to cancer is trophoblasts, a group of cells that come together and they congregate. So they are considered to be congregants. They congregate together and then make into themselves, they become very hard inside the breast. But even though most of them become hard, you have to be very careful when you look at it because not every hard feelings of the breast means that it is cancer. If there are fibroids of the breast, it too will occur to be very hard. So we also have to go back to daily checking. They are saying that you should check the breast at least one time a month, but I will say it's not the appropriate thing. I should say, if you have the time to check, you could check not just every day, but at least every week or every 2 weeks, because things seems to be going so rapid these days that you may never notice something, and before you know it, it just goes like that. You rather to do what we call early detection before the thing gets out of hand. So, cancer are congregants, cells in the body, which are cancer cells, that they congregate together and then they hunt down other good cells and turn those good cells sometimes into cancer as well. As for the cysts are oftentimes small round, what we call pockets, and then they have water in it. You can move them in several different ways. Sometimes you can inject a needle in it, and then the doctor will pull out the liquid, which are oftentimes not really the good answer for it. The proper way of dealing with it is the way how it gets in, you put it in reverse and get it back out. So we're going to talk about some ways in which we can deal with some of these problems. Now, if you guys have any questions, you can talk about it.
So, Dr. P,
Yes.
what causes that cyst in the breast?
Oh, what?
What causes cyst?
Okay, so one of the things that we need to understand is some of the things that causes the cyst or fibroids are the very same thing that attributes to cancer.
Okay.
And that is a woman and a man is made up differently. A man have, and I'm not talking about now the big A, little a, which is their lip. I am talking about something that is called hormones into the body. Now, if the hormone in a woman become imbalance, she is to be very much concerned because the imbalance of the hormones, based upon which of the hormone goes up and which one is going down, it can cause a woman to end up having cancer, not just of the breast, but of any other part of the body. Which hormone are we talking about? We're talking about estrogen. If the estrogen becomes too high into a woman's body, you can look out, even so too in men or any living beings, human being. If the estrogen becomes too high, then estrogen is considered to be a precursor for cancer.
Okay, so how will someone know that her hormone is high?
Well, there are many tests that can be taken. If there is proper labs, you can go in and you can do blood tests. And they can look into the blood and find out whether the estrogen is too high and whether the progesterone is too low. One of the things happen is that whenever you're having, and we're going to talk about that later on, is that if you're having breast cancer And if you want, you can apply called a progesterone cream on the breast, and it will help to bring down whatsoever. If it is a lump or so, it will help to bring it down. But that is just an hormone cream. There are many other ways that you can avoid, and at the same time, there are many other ways to treat, whether it's cyst of the breast, fibroids of the breast, or cancer of the breast. There are many other ways to do it as well.
Oh, okay. You said something about the fibroid in the breast. Can you brief us how does it look like or how someone can notice or find out that this is the fibroid and this is the cyst?
Yeah. Now, there is something called a breast test.
Okay.
So when the ladies are in the bathroom, or even when she finished taking her shower and she's lying in the bed, is one of the best times for her to check it. Now, if some ladies' breasts, which are always the situation, some of the breasts are quite bigger than others. So you have a full-size breast, you have extra large, and you even have small breasts, right? But how do you check to find out if there are fibroids in the breast and if what you're feeling is fibroids? Sometimes certain feelings can be between a cyst or it could be a fibroids. You just don't really know sometimes, depends on what hardness you're feeling or feeling out. If there is a soft bubble, like it feels spongy, not hard, but you could tell that there's a changes in the breast, then you know that that could be a cyst because it is the liquid. You have to bring in mind when you're feeling it. What are you feeling? Am I feeling something spongy? This feels like liquid inside. Of course, the best thing to do is after you feel it is to go to the doctor to get all the necessary tests done. For example, CT scan, or you can do other tests as well. Some says X-ray. I would prefer to say, use a CT scan, which is a CAT scan, or an MRI to find out, because those are less invasive than the X-ray. The X-ray is more pointed. It literally causes problem in the body. Okay. One of the things you don't want to do is what most doctors sometimes not thinking and prompt the ladies to do is to do what they call a biopsy. Okay. It is not good because if I have seen it, not once, not twice, many times, where a woman have cancer, never knew it was cancer, felt the thing in the breast, and they went to the doctor and they put that needle in, they pull out piece or they cut piece out and the cancer went wild. It just spread.
Wow.
Yes, and they were wiped out in actually a short period of time. Wow. I believe that the reason why this happened is because the cancer is already attacking the breast. And now they put something in there and wound it again, causing blood to be moving around in the area, which cancer prefer to have. And then the cancer just walk in and turn those cells into cancer cells. And then it spreads through the whole body.
Oh, okay.
Dr. P, please, what's the difference between the cancer and then the fibroid in the breast?
Well, cancer are mostly trophoblast cells. Fibroids are some of the breast tissue. When it becomes hard, it may not be cancerous at the time, but like they are saying in most cases that you have non-cancerous fibroids. Same way you have non-cancerous cysts. But it's kind of a little bit political when you think about it. Because I have seen where the thing was not cancer altogether. And then later on it sprouted out into cancer. So to say sometimes it's non-cancer is only to say it's non-cancer at the time when you see it. But not later on it can develop sometimes into that. Even some of what you're saying, it won't develop. It can develop also.
So as a lady, how will I be able to identify that this one I'm having is cancer or fibroid in my breast, or unless I go to the hospital to check it?
Well, you can check too, and you can actually go by how it feels, because even though some are most of the breast disease, they might come with pain. Others may come with other symptoms. Now, if you feel it and it is hard, and if you feel it and it is soft, so let's say it's one. Let's say she feels her breast and it feels soft. It's not hard. It doesn't mean it's not cancer being developed. But after you feel it and you know it's there, the best thing to do now is to go in and do a blood test. Then you will know what it is specifically. You can finally know like that. But if you don't either take a quick, and the best thing for you to do too is to move very early. Don't sit down on it because you don't know what it is.
So how do you check your breast?
Well, that's a very interesting thing to know. I forget I wanted to take on this program a bra, and not to say that I wear one, and not to say it for that reason, but I wanted to show there are many bra that has been worn by women.
Okay.
But what you don't understand is when I asked my producer, I was saying to him, they were even talking about that day you don't wear bra, right? You don't wear bra on that time. And I said, and that particular time of the month when you're saying it's breast cancer month. And I asked, do you know why? And he said he didn't know. So I said to myself, I would ask my host, which are mostly ladies, because that is what we are talking about today, right? Do you know why they said you should not wear bra on that day? Do you know?
No.
You don't know.
Yes.
Do you know?
No.
You don't know. Okay. I do not know what kind of bra you're wearing at this moment. And I don't know what kind you're wearing either. But one of the things is that we need to look at the kind of bra that women is wearing. Some of them contributes to breast cancer. And the reason why, yes. And the reason why is inside the bra, at the cup around it, there are some metal that go through them.
Yes.
Anytime you buy them, pull them out and show them up because they're absolutely not.
I see.
Yes. You see,
Okay.
there are about 8 different lymph ducts that pulls the liquid from here down to the body and from the body back up.
Okay.
One of them is here and one is here. One is here and one is here. One is also here and one is here. And then one is at the back here and one is here. No. What they do is they leak the liquid even inside the breast and come back out. What it is doing is it is making a proper circulation in the body. If the liquid of the lymph, which is the liquid is supposed to be, as a matter of fact, it is said that your body is supposed to leak up to 4 liters of liquid down and up through the day. It does that to clean the lymphatic system.
Yes.
So we're talking about the lymphatic system. Now, if those bra are carrying the metal, what they do is they lack of that portion where the liquid's supposed to come from to go in there to clean the inside and go back out. And then it runs through the body, which the kidney does the filtering, the liver do the filtering, all these different organs helping to filter it out. Then, you pass it out. But unfortunately, if those metal are in it, they seems to lock down. So what you need is to pull the metal out. That thing is like this now, it's easy.
Yes,
so it just lie there, but it's very easy around it. It's not hard or difficult that the liquid cannot go in and come out, the lymphatic liquid.
Oh, if that is the case, then it will be advisable for female to avoid bra, if possible.
Yes, it is possible.
Oh,
but if you're having heavy size, you can wear the bra, but the bra are not supposed to be like the kind we notice designed today. It is not the proper kind of bra to wear.
Okay.
But sometimes we ladies, we don't want our breasts to sag,
to jump all over in the clothes.
Yes,
yes, that's why I'm saying that in order to avoid breasts jumping left, right, center, over, then proper design of the bra should be taken.
Okay.
But it seems to me it's not just bras. even the clothing that we are wearing, their design is not appropriate. There are oftentimes health hazards in most of the clothing. If it is not the clothing itself, it is the way the clothes is designed.
Oh, okay.
And when I say that if it's not the clothing itself, even most of the BPH, when you look at the clothing, they are carrying too high a BPH in them, which are very bad for people's body. Because do not forget that we have a channel of elimination, which we eliminate toxin from the body.
Mhm.
And one of the largest eliminating organs of the body is just the skin. The skin is the largest one. And through the skin, you can bring in a lot of toxin based upon what was put in the cloth that built your clothing. That end up poisoning you anyways. To give you an example, and we're not going off point, we're talking about the clothing and we talk about bra. A study has been done in the US, and I believe I think it's the University of California. Don't really quote me on that, but I can later on upgrade it. They found out that most of the tampons that has been given to the women to wear is carrying up to 16 different heavy metal toxic, including other toxic metals element in the tampon. Now, if you know about the vagina, you will understand it is one of the only organs on the body that absorbs a lot of things. It does.
Wow.
It's one of the greatest absorbing organs of the body. So, and then when I look and see that what some of these things were, I was shocked. I started to believe somebody knows what they're doing and somebody's doing it willfully. Because most of those heavy metal toxic that I saw in the tampon, they're linked to cancer. So now I started to realize that these ovarian cysts, ovarian cancer, and ovarian fibroids, I think some of them is coming from those particular tampon that has been worn. And even the one that are saying that they were saying was organic, they were carrying too the same poison material. So I'm just saying that when it is not even the material itself, sometimes is how the thing is how the clothing was designed. It's all designed to kill you. This tight clothing that we are wearing is just not good for us. You're not in prison anyway.
Oh, okay. So, Doc, let me ask this question. Can a man or men, can they also get cancer, breast cancer?
Yes, they can. It is called, I think it's gynecoloma. It is one of the breast disease that only men have. So yes, there is one kind of breast sickness or breast disease that attributed to men, which from what we understand, it can become cancer as well.
Wow.
So it's not just women have to be worried,
So,
men too. And I heard
Okay.
when it was there, I heard about
so the prevention.
prevention.
Oh,
And concerning at what age can one have the encounter the breast cancer?
breast cancer. The age.
Can adolescents have it? At what age can one start to encounter?
Cancer
Yes.
of the breast?
Yes.
You know, that's a very interesting question. But the truth is, until now, no one cannot even specifically draw a particular age and say from here it won't happen, here it won't happen. Because things has changed rapidly. Even with the mass production of vaccine, including the mRNA, which is the messenger RNA vaccine. Now people are coming up with something that they call turbo cancer, meaning that the thing is happening rapidly and fast. And even at a young age, depends on those who take vaccine, you could end up having cancer just of any kind.
Wow.
Not just breast cancer, but any other kind.
Hey.
But let's go back now to the breast. How do you know? There is a way to put your hand under the breast and you feel like you're going around it. So you feel all the way around it. You need to understand that if your breast did not have something or you did not feel anything all along, and now you're feeling something which is quite different from what you felt before, you are to become very concerned. Now, when I say become very concerned, it's because you don't know exactly what that is, but you feel it there. The next thing you need to do, as I said, MRI, CAT scan, X-ray, you could do. That is if you prefer to do that. But I do not believe that X-ray is a preferable thing to use. It is very poisonous.
Okay.
Now, when you feel around the breast, sometimes depends on your size. If the person is small, but the breast can be big too as well. But if the person has a smaller breast, they can stand up when you're in the washroom and you feel around it. I would say do it in a right angular circular motion.
Okay.
So you go from the right side.
Okay. Okay.
Rather than going left side, kind of a little bit upward. And then you can feel around it. For women who have large breasts, what they need to do is specifically, if they try like that standing or sitting and it's not working for them, lie down.
Okay.
So when you lie on your back, your breasts do this. Now you can feel it better. And if the breast is very big, don't just feel around the rims of the breast. Feel everything. And anything you feel that is half gone, you need to treat it.
Okay. So is there any prevention?
Prevention, yes. One of the things that, as we were talking about before, that causes the development of cancer, of anything, or any different cancer in the body, is to say that your estrogen level can change, it can be a game changer for the body.
Okay.
So, for example, if you find out that something is going on and you're not feeling normal, especially when estrogen, progesterone level has changed in the body, they have to understand that, or the person has to understand that, yes, anything, they have to start looking for anything to happen in the body. One of the things you need to check first is says, okay, let me go and check and find out if the hormones is off. If the hormones are off, then you can expect almost anything to happen. And when I said if the hormone is off, for a man, a man supposed to carry more testosterone. It is what make a man sound like a man and act like a man. So he will grow a beard. When you see women growing beard and all that, which I see very plenty here, it is that sometimes the estrogen level is maybe somewhat high, but the progesterone is very low, and the testosterone that is supposed to be more of a male hormone, she is having more of that. So she's showing and displaying that kind of attitude of a man.
Okay.
So you have to watch the hormones.
Okay. 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 So now that we are done with the prevention, is there any solution?
Yes.
That?
Yes. There is a solution.
Okay.
To everything. Oh, not to everything. There is a solution.
Not everything.
Yeah,
yes,
it's everything. But it's not everything.
Yes.
No. How can we deal with breast problems? You have to take them as they come. If it is cyst, then you don't need to take a biopsy out of it. Neither do you need to run a needle into it and then pulling out liquid. Now, if anyone chooses to do that, they are welcome to do so. But there are some therapies that when you apply them, you can get the best out of it. But the first thing you need to do is to turn the estrogen level upside down in your body and bring back the progesterone back up. Now, how do you do that? You can do that through herbs. You can do that through nutrition. Well, and you can do that through hot and cold compression therapy. You can do that through a lot more of a therapy. Now, let me just take one out of it. Let's take nutrition, for example. When estrogen is high into someone's body, whether it's a male or female, what is happening is, as I said, is because apparently vitamin B levels tend to drop in the person. Now, vitamin B, let's go back to the liver. The liver treats estrogen. It sees it as a poison when it's in the body. Now, if your estrogen level is too high, and it is one of the reasons why it triggers all of that, then you need to take a great amount of vitamin B complex.
Okay.
Yes. Vitamin B will wash out the estrogen out of the body. It just wash it out.
Oh, okay.
Yes. It just
Okay.
wash it, clean it out.
Okay.
It do that. Then you have to take a multivitamin, multimineral along with that to balance everything else that is going on in the body. Then amino acid, you're going to need amino acid 3, 6, and 9. Yeah. And then you're going to need quite a few other things, FSOBA. But the best thing to do is to do a complete deep tissue detoxification therapy first
Okay.
before you apply any of these things in the body. Because if there's too much toxin in the body, then it is also one of the reasons why the hormones is off, and it's also one of the reasons why the estrogen started to climb, and it's also one of the reasons why your body now susceptible to several different diseases. So,
There are perceptions that people with bigger breasts are likely to normally have the breast cancer as compared to people with smaller breasts. How true is it?
I guess they're looking at the ratio and studies. That's what they're probably looking at. But it doesn't mean that a person who is fat or bigger, or if they're small, but their breast is bigger, that they are susceptible to have it. It's not really true. The thing is, whenever the hormones in the body, because you could be this small and your hormone is raging off, it's too far off. Your estrogen is too high. Your progesterone is too low. I have seen very small, you would say tiny women who their testosterone, which is supposed to be so little, is so high that when the time of the month comes, for them, they're bleeding constantly. And even most of the women that I found here who are having excess bleeding is because of the same imbalance of the hormones that is causing such thing to happen. And they are never always big. What I always notice though is that they are carnivores. And because they are carnivores, they don't realize. There are some studies that they won't show you. And I believe that we are not treated fairly as people who are enjoying this planet. Let me say which one of it. It's not just meat eating. Carnivore, which means eating a lot of meat. It is meat eating, yes, but it's not just the meat eating, but it's what kind of meat that they've been eating. Let me give you an example of something. If you are eating and you're going to market and you're buying meat, and you're buying, take for example, goat meat, and you're purchasing the goat, for women, what I realize is that, and this is not has been proven to the outsiders yet, but I'm saying it because I found it out. It is best for women to ask questions, and it is best for those who are selling the meat to know what kind of meat it is. And I don't mean when I say, is it goat meat? That's not what I'm saying. It is goat meat, but which of the goat? Is it Billy, as you call them, Billy? Is it the ram goat, as we call it, ram goat? Or is it the female goat that you're looking at? The same way these animals, male and female, are carrying, like you're carrying different hormone in you. They do the same thing too.
I see.
Yes, so they have hormones in them.
Oh, okay.
So that make the female a female goat and make the ram a ram goat. You see, even most of the ram, which you call Billy, is growing beard. You see them with their beard.
Yes.
It's the same kind of hormone, testosterone. Now we have in us that make us grow beard. Women shouldn't be growing beard. But then go back to the meat. When you consume that meat, and it was Billy, it is better for a male to consume Billy's meat than the female to be eating a male meat. Bull cow. That bull, do you ever wonder why oftentimes when I don't know if you ever seen it before, you see two bull slamming their head together, you hear bam, and they're doing that.
Yes.
Their hormone in them is raging, which is not a good hormone for a female.
Okay.
But when it's raging like that, they feel like they need to get down to fight or something like that. So you see them exercising their hormone and their, like you would say, testosterone. But that hormone is a male hormone. Now, when you kill that cow, please understand, that hormone don't jump out of the cow the moment the cow is dead and run away. It coming in the meat. Same as the uric acid. which is called pee, when you pee, the urine, uric acid. Almost everything in that animal is being delivered in the animal to your table. It goes to your kitchen, from the kitchen to your table, from your table to inside your mouth. You're eating these things with hormones in it. So you have to understand, meat eating is one of the things you should try to avoid. But if you're going to eat like that question, is it the rooster you are eating or is it the hen? Is it the billy or is it just the normal goat? Is it the bull or is it just they call an Eva? Well, it's different. So you have to look out for these things and make sure you eat differently. This is why I said it's safer to eat as a vegan or vegetarian.
So, Doc, do you mean if you were female and you are going in for meat, must you take the female meat or?
It's better because it goes along with your hormones.
Oh, I see.
Let me give you an example. Right here in Africa, you will notice that Africans are a large meat-eating people. They eat meat a lot.
Yes, it's true.
And also, to my surprise, the women grow beard a lot. In so much so that you cannot tell sometimes the difference between a male and a female.
No.
It's just so much beard and hair that is coming out. Those, when you ask them, and I've always done the consensus, do you eat a lot of meat? Yes. But I know why, and I can tell more likely that it is male meat. Because when I do the survey, I like to survey everything. I found out that it is easier and it is best for them. It is easier and it is best for them to kill the male. Because the female can bring more offspring.
Yes.
And so they will always have more meat or more animal. If they kill the male, if they kill the female, they have less production. So most of the meat that is on the market is male meat. And if you look at almost most of the women, every 10 women you see, you can look for it. 2 or 3 or 4 might have a lot of beard going on your back. So, I'm just saying it's the best thing to do. And the safest way to live.
Wow.
Let go the dead meat. It's only cold. Eat that. Yeah.
So, Dr. P, let's go back to the breast issue.
Yes.
There's a perception of saying that if you allow your man to suck your breast, the chance of getting cancer is low. How true is it?
It is true. Because most doctors will tell you, if a woman is pregnant, give birth to a child, and the baby is on the breast, they will always say to you, if you go in and you check the breast, the question would be sometimes, how did you get breast cancer? They are always asking that because they know it is a very unorthodox for a woman who have the breast being sucked by a baby to have breast cancer. So it's not something literally happen. It don't happen just like that. It's one of the rare cases you might have and I have seen that case too, where women is giving breastfeed to a child and they have cancer. But even when the doctor saw it, yes, everybody was just amazed, like, how did this happen? Not generally happen like that. So, but what does that really do when the sucking of the breast is the moving of the liquid inside the breast? When it's not moving, it can become hard and it can become very tight and it can become tough.
Oh, okay.
Yes, that liquid not moving in the breast. If a woman finds out that the breast is hard because the liquid is not moving and you don't have a baby, but your breast is just big and you don't have a boyfriend or husband to suck or anything like that, you can do a few things. There are some people who do hot and cold compression therapy. I do that. Hot and cold compression therapy. That's the therapy you see that we do. And what it does is it penetrates heat deep into the layer of the skin. And when the heat goes in, wherever part of the body, breast, wherever it is, you can give thing there for that, right?
Yes.
You see?
Yes.
Or we kill the pain.
Yes.
Bring the pain right down. Kill the pain.
Okay.
Like you can hardly walk when you come in, but when we finish, you can walk out. So it penetrates the layer of the skin and go deep into the tissue. And then when it goes down near the heat tend to break things up. That's how heat operates. You know, I'm a welding engineer as well. I'm a welder, yeah. So what we do is if we want to pull a bolt and if we can't move the bolt, we light the torch and then penetrate the heat on it. And when it's get hot, then we just you see pulling, easy. Could never pull it otherwise. So heat helps to penetrate and it helps to move liquids around in the body. So it's one of the ways to do it.
Okay.
Apply heat excessively.
Okay.
Herbs that can be used, vitamins that can be used, mineral that can be used. Let's start with the vitamins. Vitamins that can be used is vitamin C, vitamin A, and vitamin D. Now, amino acid is amino acid 3, 6, and 9. And that's a fatty acid. That's the fatty acid.
Amino acid 3,
3, 6, and 9. You can find that in this little flaxseed oil.
Flaxseed oil.
Yeah, flaxseed oil will give you 3, 6, and 9. Also, Evelyn primrose oil. Also, black seed oil or black currant oil. You can take like 2 or 3 tablespoonfuls per day, 2 or 3 tablespoonfuls 3 times a day. That
The black seed oil.
Like the black seed oil, the Evelyn primrose oil, or the black currant oil.
Okay.
Dr. Please, with the Evelyn primrose oil, doesn't have any effect.
Yes, it have 3, 6, and 9 as well. And it's very good for breast cancer. And it's good for breast problems as well.
Okay, the black seed oil.
It is it too. Yeah, that's why I'm giving black seed, black currant oil, even primrose oil as well. And if a woman is not sure, if she's not sure how to, well, she can use hot water in a towel, and she can put it on the breast and keep it there until the temperature rises. It will help to move the blood.
Oh,
okay.
Inside it.
Okay.
If she have to be careful, she injure the breast as well. Because if there's an injury, it can cause problem. It can develop to other problem too as well.
So, Dr. P, is breast cancer hereditary?
They said yes, it is. I believe that the chain of hereditary can be broken. I don't believe that it is a chain that remains and can't move. But I believe it can be hereditary due to the food chain.
The food chain.
Food chain.
Okay.
I believe every chain can be broken.
Mm.
So what do I mean when I say that? I mean, if you are eating too much meat, as we talked about before, and it was from your mother and your father, then it come down to you and you're doing the same thing. I believe because every disease have a cause sometimes.
Yes.
Not every, almost all have a cause. Other than man-made disease, which they make and let it go. But most disease have a cause. You have to find the cause, eliminate it, and then you will automatically get the cure for it.
Okay. Okay.
Please, with fibroid, is it also hereditary?
Well, again, most of what is happening to us as living beings are oftentimes our bad lifestyles. What we've been doing, what are we doing wrong? Sometimes we expect so much from our body, yet we do so many wicked things to it. And we expect that it's supposed to perform normal. For example, you drink alcohol, you smoke, and do all the rest of that. And then you go to your bed late at night. All these things, you're not getting enough sleep. But you want your body to carry you nicely the next day, as if everything was okay. Well, if you go to your bed 3 o'clock in the morning, and you have to wake up 6 o'clock in the morning to go back to work, that was only 3 hours sleep that you get. So the bad lifestyle that we are incurring is causing problems. So yes, it is also can be hereditary. If the bad lifestyle of the parents at the top or somebody at the very top that you live with, were a certain type and you follow in the same example, then whatever happened to them more likely from the top will also trickle down to you as well. So as I would say, in order to prevent this, live a healthy lifestyle. Become very intelligent in regards to disease, how to prevent it and how to cure it. Because if you do these things, you will be okay, to be honest. You'll be okay. Right. Now, on the Pfizer vaccines, I would say those who are implementing their own body and bringing it under subjection to take these things should know that these things have serious side effects. For example, the COVID vaccine, we now know that vaccine, from the beginning, we know vaccines were supposed to go through at least 5 or 6 different tests. The COVID vaccine never went through any, period. Mm. It was just quickly drugged and thrown on everybody. Now we know that there are so much problems. People pulling out lung stuff out of the vein in the US and Canada. Yeah, that they're pulling, doctors are finding them in their patient now. And a lot of patients losing their lives from heart attack and this. You know, treat your body as the thing that you live in. You live in here, this body, that's where you live. Don't let anyone force you upon any ways or mean at all to take anything. Don't do it. You know, consider yourself a living being, a light being, and that the food that you eat, it's supposed to be for your own health. So in most cases, don't think about just to get sick and go run and look for medicine. Let your food be your medicine. Let your food be your medicine. Food can be destructive and food can be a medicine to you. It's how you consume it too as well, and the kind of food you consume.
Okay, Dr. P, thank you so much
Welcome.
for letting us to know what is right for us. Thank you so much.
Okay, so I do hope that from what I've been presented today, that those who are in the listening or hearing position, that they will use this as a replica for their own health. Thank you, everyone.
You're welcome.
We'll see you at the next time.
Okay, bye-bye.
Okay.